Hi everybody, my name is Evet Arias. I'm a second year internal medicine resident. I wanted to take the time today to discuss a second article titled Targeted Temperature Management for Cardiac Arrest with Non-Shockable Rhythm, published recently in the New England Journal, December 2019. It was by Dr. Rascorao. And essentially the research was mostly influenced by prior studies that were done looking at this hypothermia protocol. Currently moderate therapeutic hypothermia is recommended to improve neurological outcomes in adults. But a lot of times there is kind of this debate whether what the true effectiveness of moderate therapeutic hypothermia in patients with non-shockable rhythm truly is. Non-shockable rhythms are patients with asystoles or pulseless electrical activity, not requiring any shocks, essentially. So, kind of the method of this research was the way that this research was done was an open label. It was randomized controlled trial, and it was a pretty large study. It had around 584 patients initially, but in the final analysis, there was 581 patients that were included in the study. The patients were patients from all 25 different ICUs, and I believe it was a study that was conducted in France. So the method behind this was looking at randomizing patients who are going to be going into the moderate therapeutic hypothermia group, and this was done rather quickly, as you can expect. Within 16 minutes, patients were randomized into either hypothermia at 33 c6 during the first 24 hours, or versus targeted normothermia at 37 Celsius in patients with non-shockable cardiac arrest. And these patients did go to the ICU, of course. And the primary outcome from this study was looking at survival. A primary outcome was survival with a favorable neurologic outcome. That was assessed on day 90 after the randomization occurred, and in order for them to be able to verify, have a more of a objective measure of neurologic outcome, they used a cerebral performance category scale, which ranged from 1 to 5, with higher numbers indicating greater disability. And they just said that for them, a favorable neurologic outcome would be a score of 1 or 2. I won't go over specifically what each of those mean, but you could definitely look at the article yourself and look at that. So the outcome assessments was obviously blinded. Mortality and safety were also assessed, and I'll go over those results in a few minutes. So the study did run for 4 years, and it was pretty strongly powered. So what did they find exactly? So in the end of the study, in 2018, they said that after 90 days, there was a total of 29 of 284 patients in that group that were getting the hyperthermia group. 10.2% of those were alive with a CPC score of 1 or 2, which is what they wanted. So those patients met their primary outcome, as compared to only 5.7 patients that met the primary outcome. So almost double the percentage of patients in the hypothermia group met the primary outcome. The confidence intervals was 0.1 to 8.9, so it was a pretty large confidence interval. That tells me that maybe they should have had a more powered group to be able to tell me to be able to shorten the confidence interval. But the p-value was statistically significant. So what about mortality, right? So they actually did not differ significantly between the hyperthermia group and normothermia group. 81.3% and 83.2% respectively. So there was no significant difference in mortality, and there was no significant difference in adverse events as well. So in conclusion, this study was a randomized clinical trial with 581 patients that were included in the study. Looked at both patients who were going to be getting hyperthermia protocol within the 16 minutes after a cardiac event with non-shockable rhythm versus patients that were going to be in normothermia group. The primary outcome was survival benefit with a significant improvement in neurologic status as measured by a CPC score of 1 or 2. They found that there was a significant difference in survival in patients with hypothermia protocol at 33 Celsius with at least 24 to 48 hours when compared to patients with normothermia protocol. So thank you for listening. So this is a very interesting study, and I hope you guys learned that next time you guys have a patient with a non-shock rhythm to implement hypothermia protocol right away. Thank you.